Hi everybody, welcome to Healthline. I am Gregory Zarian. Okay, so fall is here. That means you're wearing more sweaters, you're putting on your gloves. It's cooler outside. That does not give you an excuse to still not get up, go outside, work out, hike, do your thing. And also with where we are in the world, wash your hands. Keep your distance, social distance, wear your mask. Do everything that we have been reminded to do. But you can also hop onto a Zoom class. I do yoga and I also do something called One Workout. We're not given the excuse to not be active. Just because things are a little bit different, a lot different right now, does not mean that we cannot get our health on. As you know, our mission here is to tell you all you need to know about being the healthiest you can be. October is Breast Cancer Awareness Month. It's all about the pink. This month, November, it's called Movember. That's about having more of a conversation guided to us guys, men. Men don't talk about their health as much. So I invite all of you guys and you women to talk to your men and have more of a conversation. There's no reason why we can't be as verbal about our health as women are. Joining us from Adventist Health is Dr. Richard Compton. He practices family medicine and preventive medicine. Welcome, doctor.
Thank you for having me, Gregory. Appreciate it.
Happy Movember.
Yeah. I just realized I haven't shaved yet.
Okay.
Or I already shaved.
So shall we start today?
Perhaps. You know, the reason why some doctors don't shave is because they need to wear those tight-fitting masks, and so that's one of the reasons why I try to stay trimmed.
Well, here's to you and I being groomed, but that does not mean that we're not going to have the conversation about men's health.
Exactly.
And one thing about Movember, it's for all of you that are supporting the mission of it, it just means you clean shave and then you get a mustache, and that just engages the conversation. Doctor, why do you think men don't discuss their health as much as women?
Oh, that's a great question. I think it's a little bit conditioned. We're the strong, silent type, right, as men as we want to be. It's just one of the characteristics that we have. We just don't share quite as much, I feel like.
So to the guy that decides not to share as much, what is your immediate thought?
Well, I hope he's sharing it with his doctor, if not his friends around him. But talking about your friends and family about your health concerns, I think are good ideas. It might hopefully trigger you to get in and be seen to make sure you get the expert advice.
So more Dr. Compton when we come back, and we're going to share with you guys, I'm talking to you, how to get your health on and how to have that uncomfortable conversation. Because here's the truth, we want you here a long time. We'll see you on the other side. Get a glass of water, have a carrot stick, and maybe do 25 jumping jacks. We'll see you in a second. Welcome back to Healthline. I am still Gregory Zarian. Adventist Health Glendale continues to be open and safe for patients to visit the emergency room when there is a need. Visitation changes. It's in compliance with guidelines from the California Department of Public Health. Adventist Health Glendale has limited visitation with patients at the hospital due to COVID-19. Staff is ready to work with patients and families to facilitate virtual visits using FaceTime, Skype, and other video chat tools. You can learn more about visiting hours and guidelines. Go to adventisthealth.org/Glendale. Adventist Health Glendale and all of Adventist hospitals are here to make the hospital as safe as possible for you, your family, and your loved ones. They are so aware of what's going on. They are mask ready. They have sanitizers, and it is such a safe and clean environment. It was before COVID, it's during COVID. It is one of their missions to be the healthiest it can be for you and your loved ones. So if you have any questions, please visit the website. Call your doctor, ask questions, because the more you know, the more you can pass it on. So it's November, and I hope you did your jumping jacks. I hope you had a glass of water, and I hope you got active on that little bit of a break. Joining us from Adventist Health Glendale is Dr. Richard Compton. Doctor, before we spend more time talking about men's health and why they don't talk about it as much as they should, share with us about your medical background.
Sure. So I grew up all over the West Coast, but I chose to do medical school out on the East Coast, over in Pennsylvania, the Lake Erie College of Osteopathic Medicine. So I trained there. I did quite a few rotations out here because I always knew I wanted to come back to California, where I was born. And I did my residency training 4 years over at Loma Linda. And I did it both in family and preventive medicine.
Love that. Welcome back to this coast. As we discussed, men don't talk about it as much. Men don't talk about their health. I like that you were just so forthright about saying, it's more of a man thing to not talk about it.
Right.
But here's one statistic we were talking about before the show started. Cardiovascular disease is the leading men's health threat. Heart disease is the leading cause of death for men in the United States, killing over 347,000 men a year. That's about 1 in every 4 male deaths. That's awful.
Right. I definitely agree. And, prostate cancer gets a lot of attention during November for Men's Health.
Absolutely.
But the number one killer is still heart disease. And it's been that way for a long time.
And for prostate cancer, that's where I have my blue on.
Mm-hmm.
Like with breast cancer, it's paying prostate cancer blue. Why do you think there's not as much conversation about cardiovascular disease?
I think some people feel like, there's nothing that you can do about it. But
so tell me, what can we do about it?
Right. So for heart disease, if you look at different population studies around the world, back in the 1920s and 30s, they were sending medical missionaries over to Africa, over like Uganda, for instance, and they didn't see heart disease.
At all?
It wasn't there. They did a study where they looked at the autopsies of, I think it was 600 age-matched people in the United States versus an age-matched person in Africa, in
so what was
Uganda, and they found heart disease in one person, but it wasn't the thing that killed them.
So then why is there nothing there and so much here?
Right.
What are we doing here that is killing us?
Right, and so you rightly might ask the question, well, was it just because of their genes? And the answer to that is...
Because genes have a big play in who we are, men and women.
Oh, yeah, definitely. But environment also has a huge role.
Okay.
And it has a really big role in heart disease. And so what they did was they looked at immigration studies.
Okay.
When somebody would, immigrate to the United States, for instance, and start on the standard American diet, which is...
Fast food.
Which is fast food. Also is the SAD diet.
Okay.
So
I'm smiling because I get it. I get it.
Right. And so what you see is that their rates of heart disease, the rates of colon cancer, the rates of many cancers increase by changing the environment around them, changing what they're eating. And so the typical African diet was a lot of vegetables, grains, and a little bit of meat in there too, because they very traditional meals over there.
But doctor, what we do here is we do the opposite.
Exactly.
There's more meat and sugar and white than greens and vegetables, and not as much activity.
Yeah, what you see ultra-processed foods in the United States, and it means that there's very little things that are in the food that are still giving you benefit.
So then tell us what we should do then for men to knock the numbers down.
Yeah, sure. So for heart disease, there have been 3 different people who have really shown that heart disease can be stopped and even reversed. That would be Pritikin.
Okay.
That would be Ornish.
Okay.
And that will be Caldwell Esselstyn Jr.
Okay.
Who actually came and spoke at my medical school.
That's awesome.
I'm really glad that he did, because he was a cardiologist. When he put people on a whole food plant-based diet, their heart disease reversed. They did angiograms, which is where you're imaging the heart, putting in some of the dye into the heart, and you can actually see the blockages there. Well, he started them on this diet that is basically full of fruits and vegetables and whole grains, very low in terms of the fats, and for his diet it was very strict, and they removed meat altogether. But months later, they were not having heart attacks, and they redid the imaging, and their arteries had opened up again.
And that's the same thing with diabetes. You can completely turn diabetes around if you change your diet.
Yeah, as long as we're talking about type 2 diabetes, the evidence isn't as great for type 1 diabetes.
We're going to put a pause in that. More Dr. Compton when we come back. And here, let me invite you. Don't get a donut, have a celery stick, right? Right, we'll see you on the other side. Don't go away. Welcome back to Healthline. Joining us from Adventist Health Glendale is Dr. Richard Compton. Doctor, before into the break, we had just talked about how eating more of a green diet can completely change your health and who you are, and your heart health. I threw out there diabetes. Can you give us the difference between type 1 and type 2? And
Sure.
can changing your diet have you not give yourself insulin?
Yeah, so great question. There's a difference between type 1 and type 2 diabetes, and type 2 is usually a little bit of an older onset, but unfortunately we are seeing some younger kids get it as well. They're those who have a high amount of insulin resistance, and so the insulin that they have in their body just isn't doing the job as well as it could be.
Okay.
With type 1 diabetes, they are those whose insulin is almost disappeared from their body. Their body doesn't produce the insulin anymore. So changing the diet can be helpful for certainly both of those, because you want the insulin that you have to give somebody with type 1 diabetes to be the most effective. That way you can give the lowest effective dose. And changing your diet and having a healthy diet can help with that. Same thing with type 2 diabetes. We need to reverse the insulin resistance and really maximize the body's ability to use not only the sugar but the insulin hormone that it's already producing.
This is also for men and women.
Yes, yes. Yeah.
So we're talking diet. Lung cancer is really big for men as well. Talk to us about, because some of the notes are, it's still a huge threat to men. The number of deaths caused by lung cancer peaked at close to 160,000. It's decreased, but it's still pretty high. Talk to us men about smoking.
Yeah.
I smoked 2 packs a day for 20 years. I quit 15 years ago.
I'm glad you stopped.
Thank you. And I just had my heart x-rayed. Is that right? X-rayed?
Over-imaged. Yeah.
Imaged,
Yeah.
and everything is great and good to go.
Great. And that's a really important message. And congratulations on stopping smoking. What happens when your body stops smoking is pretty incredible. I think that, if we stop abusing our bodies, and if we stop punishing them with certain ingredients and the activities that we put them through, the body does an amazing job of healing itself. And in fact, 1 year after you stop smoking, your risk for a heart attack in particular would have been back down to the level of someone who never smoked at all. And so the body does incredible things when you stop kind of punishing it.
Or abusing it.
Abusing it, right.
Talk to us, doctor, about, so here's the thing. It's a choice when you wake up and you light a cigarette. It's also a choice to wake up and not have a cigarette. It's a choice when you reach for a soda. It's also a choice to reach for a glass of water. A lot of people wake up and go, oh my gosh, I don't know how this happened. And the truth is, outside of hereditary illnesses or diseases that you're born with, or hereditary markers, we do it. So when you wake up and you find out that there is lung cancer, it shouldn't be a surprise, because you're the one that's still smoking as you're reading the email or your phone, hey, come back in, we found stuff. So my wish to you is just say no. I did it, you can do it. It's a choice. If you choose to light it, choose to kill it. That's my preaching.
Yeah,
Doctor, prostate cancer, it's also huge in men. It is the second leading cause of death in men. It is estimated that 33,000 plus will die from this disease in this year.
Yeah.
Talk to us about prostates and the stigma of men not wanting to go in and have a prostate exam.
Right. Yeah. So prostate cancer is certainly an issue, and I think it's one of those diseases that worries men, and so they just kind of ignore it a little bit. If you know what I mean.
Sure.
And going in and getting a test done, or deciding with your doctor the risks and benefits of testing, I think, is a really wise choice. It should be something that's talked about. With prostate health, though, there are a couple different ailments that can affect the prostate. One is an enlarged prostate, where it just gets large and it's uncomfortable and makes it hard to urinate for men. Men often have the symptom of having to get up in the middle of the night multiple times,
Sure.
or strain, push really hard in order to urinate. That's caused by an enlarged prostate. Sometimes you get the abnormal cell growth too.
Sure.
So you see cancer as well in the prostate. And there are also infections and whatnot. But what can we actually do to decrease the risk of prostate cancer? What can we do to maybe even shrink the prostate?
Doctor, what can we do?
Yeah, so what can we do? We can focus on a healthy diet. So there's this hormone called insulin-like growth factor type 1. It's a basically growth hormone. It tells our bodies to...
So this is preventive medicine?
Yeah, I'm talking about prevention,
Oh, great.
but I don't want you to have this in excess. So places where you might take this in excess is in meat and dairy. And when you think about, a cow getting its mother's milk, right?
Sure.
It's designed to put on hundreds of pounds in a couple of months. That's how
That's
fast a calf grows. So why are we continuing to take that in as adults when we don't want to grow as much? And the thought is that the growth, that specific growth hormone could be signaling our cells to grow more than they should. And what is cancer? Uncontrolled cell growth.
Okay, that was good. Okay, wow. I haven't been stopped in my tracks in a long time. That was good. More with Dr. Compton when we come back. Do not go away. Welcome back. Adventist Health Glendale recently received its 11th A grade in a row for patient safety from the Leapfrog Group. Rated 5 stars, the highest possible rating by the Centers for Medicare and Adventist Medicaid Services. Ranked by U.S. News and World Report's best hospitals in the top 10% in the Los Angeles area, top 5% of all hospitals in California. Congratulations, Adventist Health Glendale. And speaking of Adventist Health Glendale, joining me is Dr. Richard Compton. Doctor, you wanted to clarify something that we talked about in the last segment.
Yeah, thank you. So, I wanted to clarify about what we can do about the uncontrolled cell growth of cancer. And they did an interesting study where they put milk over prostate cancer cells, and they saw that the rate of growth increased by 30%.
Wow.
Maybe it has to do with that insulin-like growth factor type 1. Then, alternatively, they poured almond milk over it. And this is not a commercial for almond milk, but the rate of prostate cancer cell growth was decreased by 30%.
What that bottom line means is just in regards to, as we're saying, have a healthy diet, a green diet. Talk to your doctor about your health and your diet. Every diet is very different. So, and just ask there's never too many questions that you can ask your doctor. Excuse me. Doctor, prostate cancer is a killer. This summer we just lost Chadwick Boseman from the Black Panther fame. Al Roker from TV personality just diagnosed with early stages prostate cancer because he went and had his screening. When does a man go get a screening for prostate cancer?
Yeah, that's a great question. And this is a very hotly debated topic among the health professionals and the different organizations out there. Some organizations even recommend against doing screening at all. But I think what it comes down to, we have tests available, and it comes down to, what is your individual risk, what is your family history, and having that values discussion with your doctor. Is it really important for me to know early on that I have prostate cancer, or, should I just take the tact of I'm going to do everything I can to take care of myself and be healthy, prevent it in the first place, and maybe not worry about the screening.
Or just do both.
Or do both.
And here's the thing:
Certainly.
or just go to your doctor. It's a checkup, and ask questions. There's another cancer. Isn't colon cancer considered the silent killer for men?
It certainly can be, yeah.
Because a lot of signs and symptoms, one of the conversations that we've had on the show is, if a man doesn't maintain an erection, and it's continuous or chronic, a man will not talk about it instead of discussing it with your wife or your partner and calling your doctor and saying, hey, this is what's going on. And a lot of that can be prevented. What are signs and symptoms in regards to colon cancer that men should look for, even though it's considered the silent killer?
So for colon cancer, one of the things you would want to look for is a change in your stool.
Okay.
What it looks like. If there's blood in it, certainly, that would be something to talk to your doctor about. Also, just
if it's
consistent, and even one episode of bloody stool, I'd probably talk to your doctor about it. Might just be a hemorrhoid, but it could be something else too. I would recommend talking to your doctor.
And all you're doing is having a conversation and asking.
Right.
Great.
Right. Also, chronic constipation can be an issue. And then in terms of really preventing it, again, a high fiber diet is, look at the large studies of, who doesn't get colon cancer. It's people who have high fiber.
In regards to, because I'm going to knock this out, in regards to men and depression, what is your invitation to them about that? Because I believe everyone suffers from a little bit of, I think we all go through a bit of it.
Sure.
But in regards to depression and suicide, what are your comments on all of that?
Yeah, we've seen the impact that election years and pandemics can have. The social isolation that many have gone through can be devastating, and we definitely need to get help. If you're having thoughts of harming yourself, of suicide, or you'd be better off not if you weren't here, it's definitely time to talk to somebody. Reach out, not only to friends and family, but also out to your doctor as well.
But there's also tons and tons, especially with where we are, and the still lockdown to some level. There's tons and tons and tons of support recovery groups. The worst thing I feel, because men don't do it as much, men don't talk. Have a conversation. Being physically active, what is your invitation to men, minimum, and then, because men are extremists and we like to go a lot above and beyond what is required. What is your recommended requirement for physical activity?
Yeah, so the national recommendation is 150 minutes of aerobic exercise, moderate intensity. So that's enough to where you're walking, you're breaking a sweat, but you're still able to carry on a light conversation with with somebody else. On top of that 150 minutes, we should be doing anaerobic exercises with the weights, jumping jacks, squats, things like that, in order to build muscle. And that should be done at least twice a week. And a lot of people forget that component of it. Now that's the minimum.
No, and I love that. And here's the thing. Because so many people are home and so many, we are in our pods. Take your family and pod it out. Walk around the block. Do things as a family. Do things, if you have to split up the family, do things together. Because as much as people hate being inside or being in these groups, you get to know who you're spending your life with more. And you get, I'm knowing my family in such a different way, and I still love you. So it's more, and it's also you're getting more intimate and asking questions.
Right.
Final thoughts in regards to that man that doesn't want to talk about his health.
Yeah. So for the guy that doesn't want to talk about his health, I don't force people to do anything that they don't want. It should be a conversation between a patient and their doctor and people who care about them. We shouldn't be forcing people to get care that don't want it. But I think just showing the concern, asking about it, say, hey, are you okay, can go a really long way in terms of motivating somebody to want to take care of themselves.
Doctor, thank you so much for your time.
Yeah, thank you.
I see both of us with a mustache very soon, and thank you for all that you do. Okay, so you heard it from Dr. Compton. It's a conversation. If you are in a relationship, talk to your partner, talk to your wife and say, hey, let's look at each other from head to toe. Let's see if something looks different. You can see my back better than I can. So it's being really, really open. Any cancer diagnosis or sickness, it's not just about you, the patient, it's about everyone in your world. Talk about it. There is no shame in saying, hey, this is what's going on, because that little conversation opens up to another conversation, and that conversation could possibly keep you here for a very, very, very long time. There's no reason why you should say, oh, I just didn't talk about it. Talk about it, no matter how uncomfortable it is. Because our mission here is to share with you that your conversation about you and your health is the most amazing gift you can give to you and your friends. You can find everything you want about Healthline Adventist Health, this show, on social media. On Facebook, we are at AH Glendale, LinkedIn Adventist Health, and you can always visit the website, adventisthealthglendale.org, and I'm at Gregory Zarian. Remember, the most important conversation you men, I always talk about you women, the most important conversation you men are going to have is about you and your health. So why not have one now? Take care. We'll see you next time. Be safe.